Hola, muy buenos días
Good
y gracias
morning.
por conectarse a
Thank
esta
you
sesión
for
informativa de la
joining
Comisión
today's
Interamericana
press
de la
briefing
Salud sobre la pandemia por
offered by
COVID-19 en
PAHO
la
on
región de las
COVID-19
Américas.
here in the
Soy
region of the
Sebastián Oliel
Americas.
del
My name is
Departamento de
Sebastián
Comunicación de
Oliel
la
with the
ODS
Communications
y esta
Department
sesión,
at
como todas
PAHO,
las
and this
semanas, tendrá
session
alrededor de
will
una
be
hora.
about an hour
Ya hemos
long.
recibido
We have already
preguntas hechas por
received your
correo
questions
electrónico y también
via
tendremos
email, and
preguntas
also
en
you
vivo
will
y
be
a
able
través del
to
chat
ask questions
mediante la
live
opción
through
Q&A.
the chat and
Para poder
the
decírselo,
Q&A
incluirnos
button.
su
Please do
nombre y el
include
medio
your
de
name
comunicación
and
al
the
enviar su
media
pregunta.
outlet when sending your
También
questions.
les recuerdo que contamos con
Let me
interpretación
remind you that we
al
have
inglés,
simultaneous
portugués y
interpretation into
francés
English,
y que pueden
Portuguese,
optar
and
por
French,
cualquiera de ellas
and
según
you
lo
may
que consideren
choose any
oportuno.
of those languages by clicking on the
Hoy el director de
interpretation
la
button.
OPS, la
Today,
doctora Carissa Etienne,
PAHO's
les informará
director,
sobre
Dr.
la
Carissa
evolución de
Etienne,
la
will be
pandemia en la
reporting on the
región de las
evolution of the
Américas,
pandemic
sobre
in
la
the region of the
vacunación y
Americas,
también acerca de la
vaccination,
situación
and
de
also
vacunación en la
regarding
región.
vaccine acceptance in the
Acompañan a la
region.
doctora Etienne en la sesión de hoy,
Carissa
Carlos
Etienne is
Jarbas
joined
Barbosa,
today
director de
by
la OPS,
Dr. Jarbas
el
Barbosa,
doctor Ciro
Assistant Director
Ugarte,
of
director
PAHO,
de
Dr.
Emergencias de
Ciro
Salud de la
Ugarte,
OPS, y el doctor Silvano
Health
Aldiguieri,
Emergencies
gerente de
Director,
Incidente
and
para
Dr.
COVID-19
Sylvain
en la OPS.
Aldiguieri,
Ahora sí,
Incident
entonces quisiera
Manager for
pedirle a la doctora Etienne
COVID-19.
que nos
I would
comparta
like to ask
algunas
now Dr.
inicios de la
Etienne
sesión.
to share
Doctora
her
Etienne.
opening remarks.
Thank
Dr.
you,
Etienne, you have the
Sebastian,
floor.
and a very good morning to you. And thanks for joining today's press briefing. Last week, there were over 1.1 million new COVID 19 cases and 31,000 new deaths reported in the Americas. And for the last few weeks, four of the five countries with the highest weekly death counts in the world continue to be here in our own region. Mexico has reported a slight uptick in cases, driven mostly by both the Baja California region and the Yucatan region over the past 2 weeks, while COVID 19 cases and hospitalizations are slowing in the US and Canada. Cuba and the Dominican Republic continue to drive most new cases in the Caribbean, while Trinidad and Tobago is still reporting high death rates. In Central America, infections over the past 2 weeks are on the rise in parts of Belize, while case incidence in Guatemala and Panama has risen over the past week. Costa Rica and Honduras are starting to see a decline in cases. Further south, recent surges in COVID infections are filling hospitals in Bolivia, Chile, and Uruguay, mostly with younger patients between 25 and 40 years of age. In the Brazilian city of Sao Paulo, 80% of the ICU beds are occupied by COVID patients. And Colombia's COVID situation is now at its highest point nationally, with very high occupancy of ICU beds in large metropolitan cities. Against this backdrop, we urge countries to tighten public health measures in places with high transmission. This is the most effective way to bring cases down until we have enough vaccines for everyone. Over the weekend, leaders from the Group of Seven pledged 1 billion COVID vaccine doses for countries in need around the world. This promise brings fresh confidence that we will overcome the supply barriers that have prevented many nations and territories in our region from getting the doses that they need to protect their populations. Today, less than 1 in 10 people in Latin America and the Caribbean have been fully vaccinated against COVID. Yet, we are a region of more than 600 million people where cases are mounting, hospitals are full, and variants are rapidly circulating. So, while vaccines are needed everywhere, we hope that the G7 nations will prioritize doses for countries at greatest risk. especially those in Latin America that have not yet had access to enough vaccines to even protect the most vulnerable. These doses cannot come soon enough, so we urge G7 countries not to delay their donations. We need the vaccines now. Across the Americas, while COVID vaccines have been slow to arrive, uptake has not. Just this past weekend, over 140,000 people were vaccinated in the Brazilian city of Manaus. And throughout Latin America and the Caribbean, people are eager for a chance to get vaccinated. So it's easy to see why, because vaccines work. More than 2 billion COVID doses have been administered around the world. In places where COVID vaccination coverage has been high, like some United States, the United Kingdom, and Israel, there has been a dramatic reduction in COVID-related hospitalizations and deaths. When outbreaks occur, as Chile is experiencing now, COVID vaccines are protecting those who are vaccinated, including health workers, from the worst of the virus. And this is exactly what COVID vaccines were designed to do, to protect our communities and to help us save lives. With the prospect of additional doses, we want to remind countries about the importance of communication campaigns to maintain trust in vaccines. Having clear and transparent information about when doses are or aren't available, and consistent guidance on who is eligible for vaccination is key to increasing confidence in our vaccination programs. It is when there are breakdowns in information and communication, or when details are slow to arrive, that misinformation can take root. The World Health Organization and PAHO have issued updated guidelines for countries making and adjusting their COVID vaccination campaigns as additional doses are made available. When these new doses arrive, we also want to remind countries that prioritizing vaccines for those most vulnerable, like the elderly, our frontline workers, and those living with pre-existing conditions, that this is key to protecting hospitals and saving more lives. Health workers should receive special attention, as they're not just at greater risk of contracting the virus, but they are also some of the most trusted voices for vaccines. People naturally turn to health workers, including doctors, nurses, and community health workers for medical advice. So we must ensure that our health workers have the information that they need to answer their communities and their own families' questions. And finally, I want to remind citizens that the vaccines authorized by WHO and delivered through COVAX have been thoroughly assessed by experts. So when it is your turn to get vaccinated, embrace what's available to you and don't delay your vaccination. Getting vaccinated as soon as you're eligible is the best way to protect yourself and your community. This also means that if your vaccine requires 2 doses, you should get your second dose when it is scheduled to ensure that you have the best possible protection. I want to be clear that the primary issue in the Americas is vaccine access and not vaccine acceptance. Across Latin America and the Caribbean, we have a long legacy in immunization and trust in the life-saving power of vaccines. Once new doses are available, countries are ready to distribute them as quickly as they arrive. And PAHO will work tirelessly to get vaccines to every corner in our region until this pandemic is behind us. We are counting on our leaders and the support of the global community to ensure that the Americas have the doses that they need as soon as possible to save lives.
Muchas gracias, doctora
Thank you very
Etienne.
much, Dr. Etienne. Now we are going to answer the questions that we have received via email and that we continue to receive through the Q&A button. Please remember to include your name and media outlet. And the first question that we have received is from Ernesto Londoño of the New York Times.
Have expressed concern over the number of people who appear to be skipping their second dose appointment. Is this a phenomenon PAHO is watching? Does it appear to be widespread in the region among populations that are eligible for vaccines? Doctora Etienne.
So thank you, Ernesto of the New York Times, for your question. So we have had reports that this is happening in some countries. And while the data is still limited, we really don't think that it is a widespread phenomenon. But even so, this should not happen. We need to use all means possible to ensure that people are fully vaccinated when their turn comes. There is strong data showing that vaccines with 2-dose regimens, like the ones that are in use in our region, offer their best protection when both doses are delivered within schedule. People that have completed their vaccination cycles are significantly better protected from severe COVID and also the risk of death. This is true even with the new variants that are circulating. Each one of us should really take the responsibility for protecting ourselves and for making sure that we show up for our second dose appointment. This is not just a matter of personal commitment. It is also a matter of public health. We know that vaccines work best when many of us are fully immunized. And this helps prevent illness and death and eventually the spread of disease. So that's why it's really crucially important for immunization programs throughout our region to set up the systems that are required for helping people get their second dose as planned. And in this, healthcare workers at the primary healthcare level have an important key role to play in following up with community members through whatever means possible. When people are where people don't come for their vaccines, the health systems must go to the people with classic community outreach, offering immunization where they are, whether they are in remote villages or in urban slums. This is the primary healthcare way of reaching those that are not yet reached. With so much inequity, we need to make sure and we need to ensure that most of the vaccines that we have at hand are used. We need to make the most of them. Stopping the pandemic for good will require that we not only have access to the vaccine, but we administer them widely, covering 70, 80, 75% of our population. Thank you.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. The next question is by David Zapata from La Prensa in Honduras, and he says, what is PAHO's opinion regarding the progress made with vaccination against COVID-19 in Latin America, in particular in Honduras, which he says is one of the countries in the Central American region that has applied the least amount of vaccines? Dr. Barbosa, thank you, David, for the question. Our director has underscored throughout our press briefings that we consider that Latin America needs to have many more vaccines than the ones they have access to right now. This is a reality in Latin America and the Caribbean. They continue to be the epicenters with high mortality rates in several countries, and access is very limited still for many reasons that are familiar to all of us, and also the fact that some countries are accumulating many of these doses. So they do need more vaccines. We do need more vaccines for the region to protect the most vulnerable population and also to attain vaccine coverage to control transmission. There are some countries in Latin America that have used several alternatives, such as the vaccine through the COVAX facility, bilateral agreements, among others, are advanced, such as Chile and Uruguay. But in most countries in our region, vaccination continues to go slower than what is needed. We continue to underscore this topic because the region does need more vaccines. In the case of Honduras, Honduras has received through COVAX 238,000 doses, in addition to other doses that will be available in the upcoming weeks. So those doses are sufficient to protect healthcare workers, but they are not enough to protect all of the vulnerable groups. That's the reason why we need to understand that we need to look for new alternatives, donations by the countries such as the US and Spain has already done, or they have committed to doing, and also the G7 countries have pledged to doing, so that we can have more equitable access to the vaccines in the world, in particular in the region of Latin America and the Caribbean. Thank you very much. Thank you, Doctor. Now, I would like to give the floor to Melina Ochoa from UNO TV Noticias in Mexico City. Melina, please go ahead. Good morning. Can you hear me?
Sí, sí.
Yes.
Muy buenos días, Melina Ochoa.
Good morning. My name is Melina Ochoa, journalist with UNO TV in Mexico City. I would like to know what PAHO thinks about this uptick that Mexico is going through in 6 federal entities: Baja California Sur, Campeche, Sinaloa, Veracruz, Tamaulipas, Quintana Roo, and Yucatan. They have been announced by the Assistant Secretary, Mr. Lapel, and whether it is necessary to relaunch actions or a new program to avoid an increase in the number of cases and deaths in the Mexican country, since people have too much information and they are not paying too much attention to the pandemic. Dr. Aldigueri, could you please address this question? Yes, thank you, Melina. I had shared some thoughts about the evolution in Mexico last week during our press briefing, but it will be a pleasure to offer you an update. Mexico is reporting regularly on a daily basis under the international health regulations, and they are also publishing updated information and the traffic lights that allow them to have a clear idea of the trend in the 32 federal entities. So even though the trend continues to be in a plateau in most states, as you mentioned, those 6 states have reported an uptick. Out of those 6 states, 4 of them are orange, based on the traffic lights: Baja California del Sur, Tabasco, Quintana, and Yucatan. Clearly, the situation in those states, such as the Yucatan Peninsula or the Baja California Isthmus, that are touristic areas, need to be accurately assessed given national and international conditions within this context. We have been informed by the federal health authorities of close contact with the states mentioned before to reactivate preventive measures and also to enforce vaccination. But a new program within this context would not be appropriate. We recommend to apply the current plan, underscoring the following aspects: the promotion and strict application of pharmacological prevention measures, the public health measures, and the acceleration of the pace of vaccination to cover the most number of individuals, the strengthening of variant surveillance, the variants that are circulating for SARS-CoV-2, and also a characterization of these outbreaks with the tools available in Mexico, including virus sequencing, as well as using the outbreak research tool, CodeData, which is a tool developed by WHO, which has been adapted and adopted by federal authorities starting last year. So once again, the idea is to implement strengthened version of the current plan, underscoring those four aspects. And I hope I have addressed your question. Thank you. Thank you, Doctor. We have questions related to the beginning of the winter season in the south and also the hurricane season in the Caribbean. And the question is, how should the countries prepare and how can outbreaks or surges in the number of cases be avoided in these two different contexts? Dr. Ugarte, thank you, Sebastian. This is a high priority issue for hurricane-prone countries and also for those countries that have very severe winters. PAHO rather has met with international regional bodies and experts as to how to face a hurricane season, but also winter within the context of COVID-19. We have witnessed the devastation as a result of hurricanes, in particular last year in Central America, where about 10 million individuals were directly impacted by the hurricanes and where there was damage to health services, and there was also an impact in the increase in the number of COVID cases. Many individuals had to resort to temporal shelters where conditions favored the transmission of the virus. In this case, it is very important to guarantee that health services continue to be operational at all times. In particular, when we're talking about health services, we are referring to health centers, hospitals, but also diagnostics centers and laboratories and other services that are provided through the public health service, so that we have hospitalization beds as well as ICU beds, and that those centers where in which people need to quarantine are functional. And we also need to make sure that individuals have access to health services, that is, that health professionals are available and ready to, in case of emergency, to travel to those areas that are the most affected. And I would like to underscore something that is highly important in the context of winter season and the hurricane season. It has been proven that the measures implemented from the outset of the pandemic, from the beginning, continue to be valid. And in the context of extreme events, this continues to be the case. That is to say, identification of clinical cases, suspected cases, and also the isolation of suspected cases, as well as quarantine for those contacts and the timely treatment of those cases. This will allow us to continue to control the epidemic as we await for vaccination to reach protection levels for the population. Winter also allows for individuals to be in closed space indoors much more often, and transmission is higher, so we need to strengthen mechanisms at all levels. Thank you. Thank you very much, Dr. Ugarte. Now we are going to move on to the next question by Emilia Dexler from Clarín, Argentina. There are several questions. What is PAHO's position in connection with the use of AstraZeneca in individuals younger than 45, and whether PAHO confirms that AstraZeneca has to be applied to everyone regardless of age and gender, and should like to know whether there has been any changes in the criteria implemented by PAHO for vaccines through COVAX to be distributed based on epidemiological risk. Dr. Barbosa, thank you. Thank you for those questions. Emilia, PAHO, at PAHO, we follow the recommendations provided by WHO vaccination expert group, that is SAGE, and also our own Gavi, that is our own technical advisor on vaccines. Those are the two groups that have individuals from all over the world, individuals that have experience, wide experience and knowledge on the use and safety of vaccines, their efficacy, and that is the group that recommends the use of vaccines. So far, SAGE with WHO continues to maintain the same recommendation regarding AstraZeneca. That is, they are vaccines that can be used for individuals older than 18. There are also very important pieces of information regarding the effectiveness, the efficacy of the AstraZeneca vaccine, and the information was communicated by the UK Information Agency that shows the high efficacy of this vaccine to protect against severe COVID cases and to protect also against deaths and hospitalizations. So the countries need to make their own decisions, but based on the analysis carried out by SAGE and also based on the evidence so far, we continue to recommend the use of the vaccine for people older than 18. The exception would be for pregnant women. There is no authorization to use the vaccines in pregnant women, and an assessment, a risk assessment has to be conducted. If it is a pregnant woman who works in an ICU or that is in contact with COVID-19 patients at all time, there is a high risk, and then there should be an assessment to determine whether the vaccine has to be administered or not. As to the debate, the discussion, this is an open discussion, and it is important to participate in that debate. And there will be a meeting in July. There will be a meeting with the Council in July, and we think that it would be important to have some criteria as to how the epidemiological situation is, so that all of the countries may receive the proportion that they have agreed to receive through COVAX up to late 2022. That is to say, the ones that requested 10%, 20% will be receiving all of the vaccines requested, but the line for delivery could be affected by some sort of criteria, so that the countries that have the highest risk could receive the vaccine first. This is an important debate, and it is important to reach consensus among the countries, among those that coordinate the COVAX mechanism, the COVAX facility, Gavi, so that we can have proper coordination with all of the countries, and we can implement criteria to perfect the vaccine delivery mechanism. Thank you.
Thank you very much, Doctor. And the next question is from Jim Silvano from Voice of America in English. Several questions, and it's
PAHO assisting Haiti in his country's effort to save a surge of the number of new infection of cases. Haiti is expecting to receive soon a shipment of vaccines. Is PAHO part of that international sharing operation? If yes, will that type of assistance continue in the future? And also, is the PAHO office in Port-au-Prince participating in an awareness campaign to motivate the population about the danger posed by COVID-19 and encourage them to get vaccinated? Doctor Aldiguieri, quizás pueda comenzar y el doctor Barbosa si quiere complementar estas preguntas.
Yes, thank you, Sebastian. I will start, maybe cover the first point and part of the third point. So PAHO is assisting the national authorities of Haiti for all pillars of the response plan to COVID-19. And as for previous emergencies, we have pre-positioned assets in the national warehouse promise. PAHO has a strong team working in Haiti, providing direct technical assistance to the Ministry of Health, MSPP, but is also working with other national partners as the Centre Guesquio, Zami La Santé, and others, and closely coordinating with international partners as the US CDC and also through the Global Outbreak Alert and Response Network called the GO. So on these pillars of the response, I'd like to highlight a couple of them. And of course, this will be complemented by my colleagues after. First, I'd like to highlight the surveillance systems, including our direct assistance to the Public Health National Laboratory, including for the genomic surveillance. Batches of samples have been processed in PAHO regional reference laboratories and have identified, for example, the P1 variant in circulating in Haiti, but also working on the expansion of the surveillance in the 10 departments, including with antigen-based rapid tests. But also the second aspect that I'd like to flag is the training and for clinical management of patients and also for infection prevention and control, including with the deployment of personal protection equipment, again, through the national warehouse. The third point that I'd like to flag is the surge capacity for managing more severe patients. And in this context, we have a couple of emergency medical teams in standby in countries of the region if their assistance is required by the national authorities, depending on the evolution of the situation. And just as an introduction to this bigger topic, of course, PAHO is working closely with the authorities on the preparation for the vaccination. This is part of our core activities in Haiti, including the communication for with the public for promoting the vaccination. And on this point, I understand that my colleagues would complement on this. Thank you, Sebastian.
Thank you. Thank you for this question. We are very concerned about Haiti and trying to support Haiti in many different areas to get the immunization against COVID-19 starting in Haiti. Haiti is the only country in the Americas that is a member of COVAX that hasn't started the vaccination yet, due to several problems, the complex situation in the country. From the beginning, we are supporting the country to prepare all the administrative measures that they need to receive the vaccines. Haiti is one of the 10 AMC-supported countries that we have in Latin America and the Caribbean. So Haiti will receive vaccines free of charge, but they need to adopt legal regulatory, and administrative measures. Everything now is ready. The government of Haiti is accepting to receive the AstraZeneca vaccine. So PAHO worked with the COVAX Secretariat to have Haiti as a priority for the new deployment that will start in July, and we will have the date in a couple of weeks to share with the government of Haiti. But we are also working in other areas, in other fronts, to get the vaccines arriving in Haiti. We are working with the US government that also has Haiti as one of the priority countries to receive the vaccine. We are working on a daily basis with the government of the US to respond all the challenges, the logistics, the administrative measures, legal measures, in order to get the vaccines there as soon as possible. This is very important because, as Sylvain Audiguieri mentioned, the cases in Haiti are increasing, so we probably will face a very important and challenging situation in Haiti, and it's crucial that they adopt the public health measures and at the same time that they get the vaccine to protect the most vulnerable groups in the country. Thank you.
Gracias a ambos. Tenemos algunas preguntas sobre Venezuela.
Thank you very much to both of you. We have some questions about Venezuela. Nicole Chapur says, what is the time frame for Venezuela making the payment to Venezuela? So can COVAX send vaccines to Venezuela without the payment having been completed? And another question about the variants in Venezuela, and if we could give an update on the C37 variant in that country. Dr. Ugarte, please. Thank you very much. First, I will refer to the general questions, and then I'll ask Dr. Barbosa to complement the answer. As we know, there is a modality of payment that the countries that have chosen what type of vaccine to receive must make a payment. This payment has been processed in most instances, and there is an amount that needs to be paid to complete full payment. All efforts are being made for the payment to be completed, and we hope this will happen as soon as possible. And this will determine how many doses can Venezuela receive, and also it will determine the type of vaccine, etc. Regarding the variants, let me emphasize that Venezuela has received support from PAHO, both from the regional level and from the country office level, to have the ability to detect the variants. This work to detect variants has been done with the National Hygiene Institute and with the Institute of Scientific Research. And the Ministry of Health of Venezuela has shared information with us regarding the results of this surveillance effort, and they have been having regular technical cooperation ties with both the regional and national levels of PAHO. The information available right now indicates that the Gamma variant is the most predominant throughout the country, and the Alpha variant has been detected in Apure and Barina. These both are variants of concern. The system can detect other variants, which are also variants of interest, and this indicates the ability for detecting these variants with the support of regional reference laboratories. And these variants of interest have been detected in Zulia, Trujillo, and Barinas. And this surveillance is very important, both to detect the level of transmission of the disease and the likelihood of increased transmissibility, but also to be able to control the dissemination, the spread, and the measures that should be taken to control the pandemic. Thank you. Thank you. Yes, let me supplement briefly here. Venezuela at the beginning was not very clear at first whether Venezuela was going to join COVAX or not. But fortunately, the country made the decision to continue on with COVAX, and they have made the payments that all countries need to make, and they have been making these payments. The countries that are high financing countries, such as Venezuela, need to make payments, and Venezuela has requested to change the contract they have there. There are two options for the high financing countries. Venezuela, at the beginning, had made a decision to take one pathway, but then they requested to change. And we supported the country in their negotiations with COVAX Secretariat so that they can go through with the a switch of the option of purchasing through the COVAX facility. This is being completed right now. Since it's a high financing country, they have to pay for their vaccines that they will receive. So we hope that within a couple of weeks, we will be able to conclude all the financial aspects. And so Venezuela can be included in the next rounds of vaccines that will be distributed through the COVAX facility. So what is outstanding is the change in contract and the finalizing payments. And we hope that this will happen promptly. Thank you. Thank you to both. Next question has to do with G7, and in English, it is
Statement about the commitment to donate millions of vaccines. Dr. Etienne?
So let me thank you for this question. Of course, we welcome the announcement by the group of 7 who pledged 1 billion COVID vaccine doses for countries around the world. So these donations and the agreements to purchase additional doses for countries in need offers what I think is fresh hope for countries that are struggling to secure enough vaccines to protect their populations, and for the people around the world who are eagerly awaiting protection. But let us be clear that this is also in the best interest of the developed countries themselves, those who have already achieved high vaccination coverage. Today, less than 1 in 10 people in Latin America and the Caribbean have been fully vaccinated against COVID. And what we are saying is that cases are peaking, hospitals are full, and we are already home to the 4 of the 5 highest death rates in the world. So the Americas, we have been in crisis for months. And without the international community's support, recovery remains a distant future. So while vaccines are needed everywhere, we do hope that the G7 nations will prioritize doses for countries at greatest risk, including countries right here in our region. Equitable access to vaccines requires that we prioritize not just the individuals at greatest risk, but also the countries at greatest risk. And certainly I think that this is both the right thing to do, and it is the best strategy to prevent needless deaths and to stop the spread of this virus faster. So this is why we hope that the epidemiology informs which countries are first to receive these donated doses and future COVAX deliveries. I also want to emphasize that timing is key. Vaccines are urgently needed today, so we urge G7 countries not to delay their donations. As we've said before, the Americas are ready to distribute doses as quickly as they arrive, and PAHO stands ready to support our countries. Those countries that are suffering the most should be at the front of the line. And finally, let me be very clear that even with this generous donation, we are still a long way from protecting the more than 600 million people living in Latin America and the Caribbean. Reaching everyone in our region with life-saving COVID vaccines will require the full strength of our collective resources. We need more donations to fill critical gaps in access, and we need them now. We need financial support to secure additional supplies, and we need to increase our region's ability to manufacture vaccines. And we are counting on the support of countries, of donors, and the international community to get us there as quickly as possible.
Thank you, Dr. Etienne. Siguiente pregunta
The
de
next question is from Julia Simesco from Reuters in Colombia. In English, she asks,
shipments of the J&J Janssen vaccine through the COVAX facility, how many doses they should anticipate, and when those doses will arrive. Also, are any doses of the CanSino single-dose vaccine expected to arrive to the region via COVAX? If so, to which countries, how many doses and when? Y agrego también una pregunta de Manuel Lino González de Los Intangibles en
and
México.
there is a question from Los Intangibles in Mexico about the CanSino vaccine. So what is the status of the CanSino vaccine in according to the WHO's evaluation? Dr. Barbosa.
Julia and the other colleague for the questions. Let me start with the second one about CanSino vaccine. We have two different processes. A vaccine can be authorized by a national regulatory authority. This is a sovereign decision for each country. The national health regulatory authorities, they assess the dossier that the producers present, showing that they meet all the criteria related to good manufacturing practices, so they have a very good quality process to produce the vaccines, and also the data from the clinical trials, phase 1, 2, and 3, confirming that the vaccine is safe and efficacious. So this is a process that every country makes, it's their decision. The PAHO's revolving fund, that is one of the two procurement mechanisms that purchase vaccines on behalf of COVAX. We use the emergency use listing, EUL, from WHO as the threshold to make the decision what vaccines can be included in the portfolio. Vaccine presenting data to be reviewed by this group from WHO. WHO, to make this assessment, it's not only the WHO staff, but the WHO established technical groups that have participants from the FDA, from the EMA, from other public health authorities in the world. They make an assessment and they make a recommendation. So CanSino is still in the process. We don't know yet when this process will be finalized. It's similar to other vaccines like Sputnik and others. Of course, that we want to have more vaccines in the portfolio, but all the vaccines need to meet the same criteria. They need to be reviewed by the same thorough process that WHO is performing. About the thing, a good news that Janssen and Pfizer will start providing vaccine through COVAX. Pfizer has already started with a small amount, but from July on, we will have more vaccines from Janssen and COVAX. Janssen is a very important vaccine to be used in some countries, in some places, because it's a one-dose vaccine. So you don't need one dose to be protected. We are still in negotiation with the Janssen to establish the quantities, the amounts of the volume of doses that this producer will provide through COVAX. We expect to have a small amount of vaccines for the months of July, August, but this will increase for the last part of the third quarter, and in the final quarter of this year, we will have more vaccines. When we will finalize these agreements, we will send to the countries the information about the doses that they are available from AstraZeneca, from Pfizer, from Janssen, and we started the negotiation to establish the date and the flight to send these vaccines to the country. So at this moment, we cannot disclose the countries will receive Janssen because we are still finalizing these agreements with the producer.
Gracias, doctor. Siguiente
Thank you,
pregunta.
Doctor. And now from Luke Taylor from the British Medical Journal and from Juri Turkewicz from the New York Times. Luke Taylor says in English,
And countries, including Colombia and Argentina, are reporting record COVID-19 deaths. What should these countries be doing to bring down those numbers? Why are they experiencing these surges now while the pandemic is receding in much of the rest of the world? And what does the situation in South America, where the pandemic appears out of control, mean for the pandemic in the rest of the world? Y similar, Julie Turkewicz, the New York Times pregunta, what are the reasons that you believe that the virus is so bad in South America and not as bad farther north? Is this just because of the Brazil variant, or are there other factors at play? Dr. Aldigueri?
Thank you, Sebastian. These many questions would allow me to stress some fundamentals of the response to COVID-19 and also to detail the mosaic of the different patterns of transmission that we are observing in the Americas. First, regarding South America, we are talking about countries with large populations that would explain large absolute numbers of new cases and large absolute numbers of deaths. It applies to many countries of South America, not only Colombia and Argentina. The second point, we are talking of countries with large metropolitan areas, I would say megapolis, that trigger closer contacts between citizens during essential and necessary
Mierda.